So Brazilian butt lift is a procedure, surgery, when we're taking some fats from problematic areas and transferring these fats. Of course, we're preparing these fats and then we're transferring to the buttocks. And then we can give a different shape and form to the buttocks. The Brazilian surgeon in 1960 started to perform this procedure, and he was a pioneer of this procedure, so that's why. Advantages is that we giving the different shape of the buttocks. We can give fuller, more rounder shape of the buttocks. Of course, we removing the fat collections from the patient's problematic areas. And if we comparing with implants, so it's a little bit different, because implants is giving the projection, the height of the buttocks. So we cannot promise for the first round BBL, we cannot promise for the patient that projection with the only BBL, but we can give that projection with implants or combination implants and fat transfer. So the good candidate for BBL is a woman with 24-27 BMI, with some fat collections on her stomach, on her sides, on her back, maybe legs. Not a smoker, with a good health. So this surgery is performed in 2 steps. So first step is when the patient laying on her back. So then we're doing liposuction of the, for example, stomach, sides, inner thighs, maybe sometimes arms. And the second step is the finish of the liposuction. So we changing the patient's position. Then patient laying on her stomach, and then we're finishing the liposuction. So we're finishing with the waist, with the sides from the back, and arms, legs if it's needed. And then we're transferring these fats. Of course, before that we're preparing these fats, and we preparing with special solution, and then we're transferring these fats into subcutaneous layer of the buttocks. About 3 and 4 liters, I think, but it's a safe amount of fat to take is 7% of patient's weight. So it's the safe line. It's depend on the patient's body, because the tissues are different, the fats are different, but around 2.5–3 hours. So first week, of course, it's the hardest week. First week can be painful everywhere. Where liposuction was performed, every week the patient feeling better and better, because the first week there's a lot of bruising, a lot of swelling. The movements are pretty painful, so that's why the patient feeling not very comfortable. But the second week is that when the patient can feel a little bit better, and every week will be better and better. So Brazilian butt lift is safe when we're doing it in the right layer, right buttock layer. So the fat should be transferred in a subcutaneous layer, and we cannot go too deep into the muscle, because into the muscles there are a lot of wide veins, and then transferred fats can be sucked into the blood vessel, and then we can get a really severe complication, the embolism with the fats, and it's a really dangerous complication. So that's why we have to know the right plane, the right layer where we're transferring the fats, and we using ultrasound sometimes if we are not very sure. So we're using ultrasound to make sure that we're in the right layer and we're transferring in the right layer.